Irfan, really great to meet you, and it's a pleasure to have you on today. Thanks for taking the time.
Absolutely. I'm happy to be here. I'm really excited about today.
So you've done quite a bit of work around promoting physical activity. Now, you've been doing this together with the American Medical Society for Sports Medicine. Can you first tell us what the society is and what it does?
Absolutely. Yes, the American Medical Society for Sports Medicine, or AMSSM, is an organization of sports medicine physicians in the United States. It has roughly 5,000 members total, and I've been a part of the organization for, at least 15, maybe more years. Um, as part of that organization, I've gotten a chance to work with different committees. First with the communications committee, then I've worked with the fellowship committee and also with the research committee. I currently chair the AMSSM Collaborative Research Network, and that's part of where this work came from, related to a summit that we put together on exercise medicine and physical activity promotion last year, or actually 2021, sorry.
And with the AMSSM, you developed this curricula for exercise medicine and physical activity promotion in US medical schools, but also in residencies and sport medicine fellowships. So can you tell us also a bit about what inspired you to do this?
Sure. It's really a marriage of two things. My previous research has been in the prevention of sudden cardiac death in athletes. And as I've taken on different roles, I've been trying to think of how can you prevent heart problems in everyone? And I think exercise medicine and physical activity promotion is probably the number one way to do that, both to treat and also prevent a number of things, cancers, chronic diseases, and many other ailments that we see, obesity across the world. The second is that I'm really passionate about education. I was the co-chair of the AMSSM Fellowship Committee, and during that time, I was looking for ways to improve fellowship education. We first started with an initiative called the AMSSM Fellowship Standards of Excellence. As I started to work through that initiative with fellowship directors around the country, I started to notice some gaps. Those gaps included really having some objective data to show us that we could improve education. So the number of training in exercise treadmill tests, or a number of ultrasounds to proceed to do within training. We didn't have firm numbers on what we needed to improve education. So this was really a part of a separate initiative that eventually turned into this initiative around exercise medicine and physical activity promotion. Some of the things that I noticed were that we weren't having many submissions to our annual conference related to exercise medicine. So I felt like there was a need to get people to be educated. And I think that the education would result in some comfort and then ability to do work in this space. As I started to do research, I found out that in medical schools, the average medical school only spends in the US about 8 hours in the curriculum around exercise medicine within the entire 4 years. And then when you look at residency training in the United States, the average program in primary care might spend 3 hours a year around exercise medicine and physical activity promotion. So that's when I realized that some of the gap may be related to a lack of education and understanding. And my hope is that by doing this work, that we'd ultimately be able to have people more comfortable to be able to do this within their programs, to counsel patients, and hopefully, and from there, hopefully impact patient outcomes.
And now talking a bit more about the curricula that you worked at, can you talk more about it and how it will impact the medical community and maybe also beyond that, the general public?
Absolutely, yeah. So the curricula, we utilized a Delphi process. We convened a panel of experts from international locations to be a part of the process. We went through a series of calls where we worked through the Delphi method. We then had experts outside of the group review the material. We also had experts in diversity and inclusion review the material. We had sports medicine fellowship directors and also the AMSSM board of directors. So this material was really vetted by a number of key stakeholders, not just in the US, but across the globe. The way that the curricula is set up is that there are 3 sections. As you mentioned, there's one for medical students, there's one for residents, and then there's one for sports medicine fellowships. The way that the curriculum is laid out in each section, there are, at a high level, there are domains, then there are general learning areas, and then there are specific learning areas. And what I really like about the curriculum is that it includes content that you could incorporate within your curricula. For people who want to shoot above and beyond, there actually is optional content for additional training. And then there is even a section on assessment of performance, so that if people are really putting together a formal curriculum, they can actually assess how is the learner doing. At a high level, the medical school curricula allows you to pull a thread together within all 4 years of the curriculum. So there are things that you can do with case studies or more theoretical work, but also how you write exercise prescriptions and learn to implement those within patient care scenarios. So there are some benchmarks for what you can do as a medical student, even for taking care of patients within your clinical space. For the residency, the curriculum really revolves around a more broader lifestyle medicine curriculum. You may appreciate that that includes not just physical activity, but also mental health, nutrition, sleep. And so we were trying to have people think of a broader lifestyle medicine curriculum, of which this is one component in the curriculum. And similarly, just building off of the medical student space, you get to do more patient care with this and have more patient logs to be able to master how to promote exercise in physical activity within your practice. For the sports medicine fellowship training, we have a very comprehensive curriculum that includes thinking about exercise and physiology, exercise nutrition, exercise training, behavior change, prescriptions, exercise in the community. It's really a broad curriculum, but we then took that a step further outside of this curriculum, and we've actually been working with the AMSSM and international leaders to create modules that are now freely available for people to use within their sports medicine fellowships that revolve around the curricula that resulted from the original work.
Great, thank you for that. So we are finding out more and more how important lifestyle is for health and also healthy aging. And so it's really important that the work that you're doing around making sure that the future doctors and healthcare professionals, that they are trained on this as well and aware of it. So how do you see these curricula being implemented in medical education, and what challenges do you anticipate maybe and also in the implementation?
Yeah, that's a great question. So my hope is that now we can start to work on the implementation piece as you're describing. That will take some work, trying to convene medical schools to think about medical students. And there is a group called the AAMC, the American Medical Association, and medical colleges. And so if we can work with them to think about how to implement this at the med school level, I think that may provide robust implementation at that level. Within the residency side, there are groups. There's an American Family Medicine Residency Directors Consortium, and to work with them on how to implement that at the highest levels for residency training. And then finally, AMSSM works very closely with the sports medicine fellowships within the fellowship committee, and that would be the way to think about implementation within sports medicine fellowships. Most of our work to date has really been focused on developing those modules and I'm proud to say that all 8 of the modules should be available here in the next couple of weeks. I think the last module was being finalized, but those should all be ready for the AMSSM annual meeting that is in April of this year. In terms of work to do, I would love to work with folks to think about the implementation and then also to study the outcomes related to the implementation within those 3 different spheres. Certainly, there may be some challenges, but we can always think about how to address those as a group and as a team. And then we can always think about creating version 2.0 if we need to, as we learn more about what has worked and what hasn't.
Great. Irfan, thank you so much for sharing, and best of luck with your further work. Thank you.
Thank you. Thank you so much for taking the time to meet with me. Again, I'm really excited about the work that you all are doing and would love to continue to support you in the future.
Great. Thank you.